there is certain conditions in which you can see things happening early, but also biologically being aggressive. One of the fields in which there's been a lot of work ongoing about diversity and healthcare disparities is, for example, breast cancer. So we learned that people from color has more chances of having what we call triple negative breast cancer, which is basically the most aggressive form, chemotherapy resistant breast cancer type. And at the beginning, the big question mark was always when we were seeing these worse outcomes in people from color was, is this basically driven because of the lack of literacy, lack of resources, lack of access to care? And many times the assumption was that healthcare disparities because lack of access. Until someone says, well, let me answer the question we are all guessing. Because we can all guess why something happened, but we have to prove it. And that's what science is about. We need to prove it. What at the end, what we are able to prove, or we've been proving so far, is that yes, these people lack resources, but they also have more triple negative breast cancer, which seems to be the part of being driven that. So now let's go back to lymphoma, because I gave that first example. This is what right now the ongoing research is. We're seeing disparities, we're seeing changes. I already gave you example of certain diseases in which it's not about money, it's about biology. So is the biology on patient with color on CTCL differently? So that's what many people, including myself, Dr. Pamela Allen, who's been fantastic doing all this research, trying to answer. And for that, we need a lot of patients in which we can look into the human genome and try to see if there is any drivers could potentially lead that, knowing that at this moment, not much is known about which genomic drivers could potentially lead to certain things. What we have learned, for example, is patients with cutaneous T-cell lymphoma that respond to mogamulizumab at the beginning, when they lack response, one of the factors that we've seen commonly is that they acquire a mutation in the CCR4, which leads to less expression of CCR4 and therefore less response. So we don't know if that's something more frequently seen in people from color versus people from no color, and because we don't have enough studies to really prove it. But that's what we see. So is that a reason? Is a genomic feature, or in fact, it's just lack of resources and lack to access to care? However, epidemiological studies show that in fact, people from color tends to have worse outcomes than people that are white or non-black, as we call it. But the main question again comes into, is that related to resources or that's related to biology or maybe both? Those are things that hopefully in the next years we should be able to answer.